I welcome you to the Healthy Heart, Healthy Life Pune, session 18E. I'm Dr. Neelkant Karandikar, senior cardiologist from Pune. I'm the chief cardiologist at the Heart Clinic, Mukundnagar, Alpha Diagnostics, and Raghav Diagnostic Center. Interventional cardiologist at the Ruby Hall Clinic, Sahyadri Hospital, and Dinanath Mangeshkar Hospital. Honorary Professor Emeritus in Cardiology and the first gold medalist of the Bombay, now Mumbai University. Today we are going to discuss a very vital topic, ambulatory BP monitoring or ambulatory blood pressure monitoring, an underutilized tool. Let us first start with discussing how we all spend our day. A lot of time of the day we spend in our office working, maybe with computers or with some other work. We are at home. The next common thing we do, we are at home relaxing, doing something else, or we may be exercising. Look at this young fit lady jogging in the morning, or at the end of it all, we go into deep sleep. In the morning, we wake up, from the sleep with a smile on the face. Ideally, there should be a smile on the face. And then we get ready, go to office, and the circle starts all over again. Now, let us see what happens to our blood pressure during our 24-hour routine. In the office, it's like going to a doctor's clinic. There is slight rise in both the systolic and diastolic. The upper yellow line is the systolic or upper blood pressure. Lower yellow line is the diastolic or the lower blood pressure. There is some rise in the office or at the doctor's clinic. In the office due to work, in the doctor's clinic, maybe some people are a bit anxious. We have talked about white coat hypertension. Then there is the daytime blood pressure, which keeps fluctuating up and down. Here and here, it is shown depending upon what kind of stress you are facing. If there is some stress, BP will go up. If there is no stress, BP will come down. Then at home, when you're relaxed, the BP comes down, dipping pattern, it is called. And especially at night, in a normal person, the blood pressure should come down by 10 to 20%, both the systolic and the diastolic. And in the morning when you get up, we saw that girl raising her arms and waking up in the morning. At that time, there is a morning surge of blood pressure. The blood pressure rises in the morning. That is why so many heart attacks, they occur in the morning. Now, out of all these readings, the most important probably is the nighttime blood pressure. The blood pressure which we don't routinely measure, the nighttime blood pressure. This is a graph. On the y-axis is shown 5-year risk of cardiovascular death. That means death due to a heart problem. And here on the x-axis is shown the systolic blood pressure. So the higher the systolic blood pressure, especially at night, higher will be the heart problems or even death rate because of the heart, then a heart problem. The next important thing is the 24-hour average blood pressure. Then the daytime blood pressure, and the least correlation is with the clinic blood pressure, which is measured in the doctor's office. So, what we routinely do, that is measuring the blood pressure at the doctor's clinic, is of course important. It gives you the sort of indication whether you have high blood pressure, normal blood pressure, or what. But these other values, daytime blood pressure, 24-hour blood pressure, and especially the nighttime blood pressure, if that is so important and linked to 5-year risk of cardiovascular death, then the next question that arises is how are we going to measure this daytime blood pressure, 24-hour blood pressure, and especially the nighttime blood pressure? How are we going to measure it? We'll come to that, but before we come to how we are going to measure these blood pressures at night, during the day, 24-hour average, let us see what are the blood pressure levels at night and the importance of these blood pressure levels. What is shown over here, called a dipper, is a normal thing that should happen at night. That means your blood pressure should come down by, say, 10% to 20%. Suppose your blood pressure during the day is 14. There should be, oh, sorry, I'm sorry, 140, I wanted to say, systolic blood pressure. And then at night, there should be a drop of 14 millimeter to 28 millimeter at night when you sleep. That is a normal pattern and it is called as the dipper. This red pyramid starts at this level, dipper. Then there is the non-dipper. The person whose nighttime blood pressure does not come down by 10 to 20% is called a non-dipper, and he has a higher risk of heart disease. And the worst is if your blood pressure is rising at night instead of falling, then you have the worst risk of getting heart problems. Even extreme dipper, where the blood pressure drops to less than 20% of your daytime blood pressure, even these people are at higher risk. So this graph shows what happens to your blood pressure at night time. Then the second most important time is the morning when you get up. It is called as a morning surge. When you get up, the sympathetic system of the stimulatory system in the body wakes up and starts secreting hormones like adrenaline, noradrenaline, and your blood pressure rises. Now, if there is a mild rise of blood pressure in the morning, fine. Slight rise, again fine. But if there is a significant rise of blood pressure in the morning called as morning surge, then it is bad for you. You could develop a heart attack because there is a morning surge puts an extra load on your heart. And when can this happen? If there is extreme cold, or if you suddenly start doing a lot of exercise in the morning without first warming up your body. Worksite stress, smoking, alcohol, lack of sleep, and a condition called sleep apnea, which we will be discussing in a completely separate session. If all these conditions are there, then you will have a high morning surge. So, very, very important is what happens to your blood pressure at night and what happens to your blood pressure when you wake up. Nighttime and morning. These two are very, very important. This chart highlights what I said just now. In dipper, which is normal, more than 10% but less than 20% decline of systolic blood pressure. Then non-dippers, when there is 0 to 10% drop. There either no drop or less than 10% drop of blood pressure at night. These are non-dippers. And reverse dippers, when the BP there is a rise at night, these are called reverse dippers. And the extreme dippers are those where the blood pressure drops by more than 20%. This is also bad. So this is the worst. This is bad. Reverse dippers is bad. Extreme dippers is bad. Non-dippers is not good. And dippers is normal. So these are the kind of patterns that happen at night. So let us see what is all this called. It is called blood pressure variability. Our blood pressure is known to have variations over 24 hours, which is caused by many factors, mainly circadian modulations. Circadian means change over time during the day and at night. Among the most relevant, there is the physiological nocturnal or nighttime reduction of systolic and diastolic blood pressure, which in normal subject defined as dippers is about 10 to 20%. Excessive fluctuations of blood pressure increase the likelihood of myocardial, vascular, renal alterations and contribute to cardiovascular events like heart attack and increased death rate and mortality. We have seen that hypertension has many faces like the Ravana. These are called the phenotypes of blood pressure. Sustained hypertension, when there is a consistently high reading in both settings, both means in the doctor's clinic and at home. Both places your blood pressure is raised is called sustained hypertension. White coat hypertension, elevated clinic blood pressure at the doctor's clinic, but normal 24-hour ambulatory blood pressure monitoring, which we'll see what it is. And masked hypertension, normal clinic blood pressure at the doctor's clinic, but elevated 24-hour blood pressure. So these are the BP phenotypes. Among these are the three most common. Other than these, there are also some more phenotypes like this, called as a postprandial hypotension. Look at this young lady. She's having giddiness after food. The sudden drop in blood pressure after eating is called postprandial hypotension. Currently, postprandial hypotension is defined as a fall in systolic blood pressure more than 20 millimeters of mercury or a decrease to less than 90 millimeters of mercury when the postprandial blood pressure is more than 100 millimeters of mercury within 2 hours of meal. So to summarize, what happens is within 2 hours of eating food or a meal, there is a blood pressure drop, which might produce giddiness. And this is bad because the giddiness can lead to accidents and it can lead to less blood flow to many organs in the body, which is not at all good for your body. Now, let us come to the very important data of how to measure blood pressure throughout the day and night. Blood pressure measurement, it is by automated sphygmomanometer or automated blood pressure measuring instrument, and that is called as an ambulatory BP measurement instrument. Here is the cuff, and this is applied to the person's arm. Like here, I'm showing my arm. It is applied on the arm, and this is the monitor. This is actually a home blood pressure measuring instrument. This is the proper ambulatory BP monitor. Here is the cuff applied to the patient's arm, and by means of a tubing, it is attached to this machine. Uh, the sphygmomanometer cuff is connected to the monitor by means of a tube that goes under the shirt. And then what happens is that every 20 minutes, this cuff automatically gets inflated with air, and then it slowly comes down. The blood pressure, the air is slowly released from this cuff, and the person's blood pressure is measured, usually at an interval of every 20 minutes. See here, This is the kind of graph you get. Here is the systolic blood pressure chart of a person. He has breakfast, he goes to the gym, has breakfast, and gets ready and goes for a board meeting. He sits in the chair, he is the chairman, and the blood pressure is rising because there is a stress of conducting that meeting. Then the meeting ends and there is lunch, and during lunchtime, the blood pressure has come down. Then he has to deliver one lecture. First lecture, some rise of blood pressure. Second lecture, little more rise of blood pressure. After the lectures, he relaxes and the blood pressure comes down. Another lecture by the same gentleman. He's a big shot officer in a big company. And the lecture three, again, there is a rise of blood pressure. Then he goes for a walk, leisurely walk, and the blood pressure has come down during the walk. There is a formal meeting and dinner. There is a blood pressure is around the usual normal range. And nighttime leisurely walk, again, BP has come down during sleep. Again, there is a drop of blood pressure, which is called as a dipper. So this kind of a chart tells you what is happening to your blood pressure throughout the day and also at night. And it is very, very important. I don't want to get into the details, but whether your treatment is being properly, is adequate for you, number one. Number two, the timing of the drugs given to you, medicines given to you, whether that is correct or not. What is the time the blood pressure is rising, whether your blood pressure is responding normally at night, whether you are a normal dipper, extreme dipper, a non-dipper, or a reverse dipper. All this information is given by this machine called as a ambulatory BP monitor. There are some limitations. There is some patient discomfort because every 20 minutes the cuff gets inflated. There is some cost, not very costly, but it's a little bit of cost you have to bear. There could be disturbance of work and sleep. You are working and suddenly the cuff gets inflated and then you get disturbed. And at night, most people tolerate it very well. In some, there could be a sort of disturbance in the sleep and loss of data due to technical problem. If the attachment with the tube to the machine, etc., is not correct, there could be some loss of data. So, ladies and gentlemen, today we have seen a very important aspect. First of all, we saw that the blood pressure doesn't stay constant throughout the day and at night. The blood pressure keeps going up and down. And it is not really adequate to measure your blood pressure at the doctor's clinic or at home with the home BP machine. But at least once you must get, some patients need it even more than once, you must get your 24-hour blood pressure measured. And that is done using the ambulatory BP monitoring. It is very, very important. It is underutilized, but I recommend it to many of my patients and they all definitely benefit from it. Thank you very much for watching this session. I'm sure you must have subscribed to my channel. If not, do subscribe. Do recommend this channel to your friends, relatives, and other contacts. So because I want to spread this information, you would also like to spread this important information to as many people as possible. Thank you very much. See you next time.